After 15 years of advocating for veterans, it's now my pleasure to serve as the Executive Director for the Veterans Northeast Outreach Center. An organization that originally started in the city of Lawrence, just a storefront operation back in '86, helping Vietnam veterans get their claims through the VA. Since then, the organization relocated to the city of Haverhill and has expanded quite a bit under the leadership of the late Command Master Chief John Ratka. We now have over 60 full-time employees providing over 200 affordable housing units for our veterans throughout the area, North Andover, Chelmsford, Westford, Haverhill, Methuen, Newburyport, and it goes on and on. We actually have a program right now that we're expanding into New Hampshire. But we're not just a housing-first organization. Getting them a roof over their heads certainly is a priority. But once we establish that, we want to make sure that we meet their immediate needs, whether it's mental health, professional, financial counseling, depression, whatever their primary issues are underlying. We want to find those and take care of them. And we've implemented a really good program to help us with that. First, we have a database that's specifically designed for all our programs and services so that we can track the veteran from intake to one referral to the next referral to training to employment and ensure that they continue that upward mobility.
At any given moment, VNEOC always has between 175 to 200 veterans in our housing programs. And housing programs could vary. It could be a permanent housing situation where you reside in a 1 or 2 bedroom apartment where you have rental assistance. We also have several other programs, one down at the Bedford VAMC, the Veterans Campus, which is a temporary bed program. Some of these things are 60 to 90 days, and the goal is to basically find permanent housing. So we will do everything we can to get you to the finish line.
Even once we get a veteran stabilized in affordable housing, we want to continue to provide that support. So they will stay in our data system, and we will continue to check up on them.
I know for me it's personal. I want to make sure that everybody that walks through those doors knows that, we are that one-stop shop. If we can't do something on site, then we are direct referral partners with the VA, with the Department of Veteran Services through the Commonwealth of Massachusetts, and all VA campuses both in southern New Hampshire and Massachusetts.
We have an endowment program where we have corporations donating $25,000 a year and committing 5 years, and after so many years, 3-4 years, we'll be able to withdraw from that fund to build affordable housing for veterans. We have another program that we've implemented, the 0 to 60, where we give incentives for veterans to basically not find their own apartment, but actually purchase their own home through the VA home loan program. And 0 to 60 is basically within 60 months through the proper counseling and financial advising and saving and all that within 60 months they'll actually be able to purchase their own home.
We're hoping to open back up. Our service center hasn't been open to the public since the COVID-19 shutdown, but there's a lot of veterans out there that need that social emotional connection with their peers. We try to do the best we can in a virtual model, being able to do telehealth appointments, whether it's through laptops or tablets or things of that nature. But, we understand the importance of that face-to-face connection. And, with that, our service center offers music lessons, yoga lessons, access to resources. We have a Tuesday and Thursday food pantry at 10 Reed Street, which is our service center in Haverhill. We also do pop-up food distribution sites at Northern Essex Community College on every other Wednesday, as well as North Shore Community College in Danvers. Those two alternate. We just added a third site at Manchester by the Sea. We also have brick and mortar locations out in Metro West in the Marlborough area and also down at Cape Cod. In the last 6 months, we have distributed what accounts to be tens of thousands of individual meals for those who need it the most. If you do need help when it comes to food and getting through the week, just please contact us. Go onto our website, contact the main number, and be able to talk with any one of our staff, and we can get you situated with some relief right away.
Right from the get-go, I remember when I retired from the Navy, my first impression of a veteran service officer, it's like everybody says, you only have one shot at providing that first impression, and I remember it, and I share it with all of my veterans, and I know every other veteran does the same thing. So it's important that we not only provide that solid impression, but we follow through with it. So here at the VNOC, right from the intake, we have a case manager assigned to the veteran, and then in addition to that, we have what's called a veteran advocate provided to the veteran. So the veteran advocate would be somebody that the veteran actually relates to. If it's a female veteran that comes in, then she will be paired up with a female veteran advocate. A veteran that has PTSD or need for a service dog, we will pair them up with one of our employee veterans that have the same issues. And what that provides the veteran is that wraparound, that sense of wraparound, that security right there.
You know, I had a hard time connecting all the dots. I had a deployment to Afghanistan a few years back. I didn't think I needed supportive services. I mean, you can call it pride, or, you know, maybe those aren't for me. There's somebody else out there that's worse off, or I could figure it all out by myself. And I think a lot of veterans that are out there, they probably have that same mindset. It's never easy to say that you can't do it by yourself. I went through 2 years of an administrative nightmare trying to figure out who I needed to talk to in order to get where I needed to be. And in 6 months, this organization helped me get comp and penned, get my first service connection check, and allow me to honorably retire from the Air Force. So for me, to be able to come back and work for that organization that helped me so much, it truly is a blessing. We can't stay stagnant. And I guess I say that all the time to people. If you do the same thing for everybody, it's not going to work because everybody's different. So it's our job to evolve and ask those critical questions and try to be able to find the right supports, not just for today, but to set them up for tomorrow.